Hi guys, I want to talk about a clinical mindset for dosing of exercise and exercise prescription. One thing that we're really big on in our clinic at Refine is really making sure that we're getting stimulating reps with our patients. And so what I mean by that is making sure that we've challenged them enough to have or experience some type of a physiological change in the muscle or tendon unit. And so one of our goals in the clinic is to break away from that pattern of 3 sets of 10 with some type of an exercise flow sheet with every different variation of resistance. So TheraBand or light dumbbells or kettlebells, like our exercise dosing needs to change based on the patient's relative baseline as far as like their tolerance to submaximal loading, their general fitness and wellness overall, and then also like their rate of perceived exertion with the activity. And so a couple of ways that we'll track things is within the history and the subjective, you should get a good understanding of where that patient's been and what they've been doing. So are they sedentary or are they an active individual? Are they a competitive individual? And so knowing some of those things can give you a baseline of like, okay, what kettlebell am I gonna start with? Am I gonna hand them an 18-pound kettlebell for a bent over row? Or if this is someone who has never done the movement before in their life, I might put a 5-pound weight in their hand for day one just to let them see how that feels. Versus a competitive athlete, I may start them at 44, 45, 50 pounds, something like that. And then from there, you can ask the patient or ask the client, hey, how's that feeling? Is it heavy? And look at some of their body cues. Are they controlling the weight? Are they having difficulty moving it? And then also you can say, okay, I want you to keep moving through those until you feel like you're starting to fatigue. That gives you an idea of their perceived exertion. When they put the weight down, you say, hey, how did that feel? If they're like, man, that blew me up, then it's like, okay, we may need to back you down, or depending on the number of repetitions, that may be right where we need to be. And then from there, I can basically decide, does this need to be heavier? Does this need to be lighter? Can I change the rest time to make this more challenging or less challenging? And then what is the patient in here for? So, if they're coming off of a rotator cuff repair and they're 2 months out, am I really gonna wanna put a 53-pound kettlebell in their hand if they're a strong individual? Even though they probably could do that when they're healthy, and they could do probably a lot of them, it might be that I'm gonna keep them at a 10-pound dumbbell or 15-pound dumbbell and then slap some BFR on them or something like that. And we can kind of talk about some of those principles moving forward. But I think the main thing is, and what I'm passionate about in the clinic, and especially for up and coming students and clinicians, is don't be afraid to communicate with your patient during the dosing of exercise, because the challenge is you have to give them stimulating reps. If you don't do that, then they're not going to see a true physiological change in the tissue. It may decrease their pain, you may help improve their movement patterns, but it's probably not going to give you the response you need for long-term change. So something to think about as far as exercise dosing. We can talk about that more as we go. That is definitely something that we're very passionate about within our business. And I think it's a place where we swing and miss a lot within the field of physical therapy.